And we should be live. Hello, everyone, and welcome back to another session with Dental Shadowers. My name is Isa, and today we have an exciting session with Dr. Keil. Dr. Keil, thank you so much for joining. And on that note, please take the floor whenever you're ready.
All right, cool. Well, hi, guys. My name is Dr. Keil. Today, I'm going to talk about a little bit what it's like to be a female dentist. And a little bit about something else you can do kind of with dentistry if you're interested. There's a lot of specialties in dentistry. I think there's 5 recognized specialties, but you can really take your degree and kind of do what you want with it. So I thought I'd talk a little bit more about something different today. All right, so a little bit about me, my journey. A little introduction first. I am a real person. I am a dentist during the day, but I'm a real person all the other time. So I'm probably going to swear during this. I would rather you guys see me as your peer than as someone who you can't talk to or you're afraid to ask questions to or anything like that. I'm a person. I went through this not too long ago, 5 years ago. So it's fresher for me than it is for others, but I'm going to talk plainly. So if you hear my doctor voice, it will come out later, probably in the second half of the presentation, but I'm just going to be me as much as I can throughout this. And if you follow Raven, the Science Maven on Twitter, she's awesome. I highly recommend it. All right, so a little bit about me. I was born and raised in Michigan, in Ann Arbor, actually. I grew up playing ice hockey in Michigan, and I decided in high school that I really wanted to spend my time helping people. I didn't know if I was going to help animals or if I was going to help people at first. So in high school, I did a little bit of shadowing. I went and shadowed a veterinarian because I thought that was really what I wanted to do, but discovered it was really hard for me to deal with sick animals all the time. Like happy animals, great, but sick animals was a little harder for me. So said no to that. And then there were other factors. If we can skip through to the next slide here. Oh yes, this is dentistry in a nutshell here, quick. Just a quick little meme. It's really not what you think it is. Like there's so many perceptions of dentistry. So I just thought the meme was kind of funny. So I included that in here. But anyway, so yeah, let's go to the next one here. So you have to kind of think about, okay, how much time am I investing? How much money am I investing? And what is it going to pay off? What is my return on investment? What is my lifestyle going to be like? What is my day-to-day going to be like? And I felt that dentistry was a little bit better suited to me. I really like to work with my hands. I like to be my own boss. I don't really want to be part of a giant corporation. So my weaknesses are that I hate authority. I don't like being told what to do ever. I don't like being managed. So those things really appealed to me about dentistry, that I could kind of do what I wanted. And I also don't like to work in isolation. I do like to interact with other people and talk and chat. So like I said, did some shadowing in high school, kind of decided on dentistry. And then basically as soon as I went to college, it was dental all the way. At Michigan State, there is no pre-dental major. I still don't think there's a pre-dental major, but y'all can correct me if I'm wrong on that. So I did my BS in psych, which was awesome because I love psych. I was thinking about going into psych, but 12 years of medical school didn't appeal to me. So then I went and I got into the University of Michigan, 2012. So I went straight from undergrad to dental school, which in hindsight, maybe I should have taken a year or 2 off, not to think about my decision anymore or anything like that, but just because I was tired. Like I went into dental school tired, and the first 2 years of dental school are hard didactic work. So I felt like the kids who had taken a couple years, they were really kind of better off, and they were more ready to dive into the hell that is dental school. I won't lie to you. It sucks. It's fun. You're going through it with a group of people who is also really dynamic and really awesome, and you kind of commiserate through this experience together, but it's hard. I won't lie to you. You will cry at least once. And then after I joined dentistry, my first year was kind of rough. I decided to go into private practice. I felt really ready to do that, but the associate world in dentistry is not the nicest. So they pretty much treat you like you're disposable. So I got hired into a job and I saw 2 patients in 4 months, but I didn't know any better. So I was like, it'll get better. It'll get better. It never got better. So I ended up going through 2 more offices, just didn't fit right. They said that there would be mentoring, and then I got there, and then the owner was never there, so there was no mentoring. So it took me a while to find the right fit, but I love my office that I'm at now. I've been there for almost 4 years, 3.5 years, and I love the staff. I love where I am. So don't be afraid to move around because it's totally worth it. All right, let's move on. Just a couple quick things. So just so you learned something today and you just didn't have to hear about my story. A lot of people think that cavities only come from sugar or pop. And that's true, that's a huge causer, but cavities actually aren't caused by the bacteria eating away at your teeth. It's actually the bacteria eating the food in sugars in your mouth, and then their waste products destroy your teeth. But in order for those bacteria to function, we need an acidic environment. So your saliva obviously is neutral, pH at about 7. Anytime you dip below that, it's like happy time for those bacteria. They are going to town in there. So it's not always just pop. I mean, you can think about things like coffee, orange juice, LaCroix is really acidic. And they're just not typically things you think of in terms of causing cavities. But if you're sipping on these things all day, every time you take that sip, you're reintroducing that acidic environment, you're reintroducing a food source for the bacteria, and it takes your mouth an hour to renormalize that. So it's better to chug your coffee than it is to sip it over like 2 or 3 hours while you study or while you're in your first class of the day. It's better to chug it. So I know that's not popular. I won't tell you to stop drinking coffee, but just try to drink it in a smaller period of time if you can. Another big thing is people love to rinse their mouth out when they're done brushing their teeth. And that is like, you basically just pushed a ball up the hill to watch it roll back down. So you want to brush the toothpaste onto your teeth and then leave the toothpaste there. If you rinse your mouth out or if you use mouthwash after you've brushed, you actually just completely negated everything you did with the brushing. So don't waste your 2 minutes. Don't rinse your mouth out. You can spit. A lot of times, like I kind of hang around the sink for like 30 seconds or so and spit 4 or 5 times, but don't rinse your mouth out, please. And then another big thing, especially for you college students, you may have some times where you puke in the morning when you wake up or late at night, and you want to be a good little person and brush your teeth and keep them really healthy because you guys are pre-dental, of course. So your instinct is going to be to brush like right away. But again, remember, the acid from your stomach has now made your mouth really, really acidic. Plus the fact that you probably haven't drinking water in a minute. Then you add your abrasive toothpaste in there. And what you're doing is you're actually scrubbing off the white enamel of your teeth. You're making them weaker. You're making them thinner. So throw up, rinse your mouth out with some water, go back to bed for an hour, let your saliva do its job, and then go brush your teeth. That's the best way I can say to handle that situation. All right, let's move on here. Yes, so the first half of my talk today is really kind of more about what I wish people had told me before I got into dentistry or before I applied to dental school, things like that. Obviously, we know all the pros and cons already of, being your own boss, setting your own schedule, things like that. But there's a lot of stuff that they don't talk about. So one great thing is that being a dentist, you can pretty much find a job anywhere. Like I know a guy who lost his job during the pandemic and found a job a week later in the same city. Like it's just not really hard. There's a lot of jobs out there. Now finding a job you like is going to be a lot harder. Every office works differently. So if I have any advice to you, if any of you guys go into private practice, don't go practice with someone you like right away because you're probably not going to end up there. I would recommend trying out 2 or 3 offices, really moving until you find something that's for you, because otherwise you're going to hate dentistry a lot faster, and I don't recommend it. Let's see. Obviously, yes, we all know we're going to make good money in this job, but a lot of times your loans are going to kind of offset that, at least in the first quarter of your practicing. The first 5 to 15 years of your practicing life is really not going to be a lot different from your school life. Are you going to be eating ramen and stressed? Maybe not, but you're not really going to be flying internationally all the time and taking a lot of awesome vacations either. So the bad, dentistry is changing. Dentistry is changing a lot. Obviously, reimbursement goes down every year because insurance companies are always trying to price us out, give us less and less. And the cost of business goes up every year. There's 2 or 3 giant dental companies that kind of supply all the supplies to dentists. And they're really tested, they're really trusted, things like that. But they just got in really big trouble for inflating all of their prices. And at the end of it, they had to pay $50 million, but they did not have to lower their prices. So it's like we get some retribution, but not enough to like change our practice in the way that it gets better. I'll talk a little bit more about Delta PPO creations a little bit later on. I think you guys have already heard or have learned about what DSOs and DDSOs are. These are basically just corporate or dental corporate offices. Now, it does make things easier because you've got a couple people in the same location, so you can share supplies, you can share costs, you can share employees, all that good stuff, but you're going to hit more of a ceiling because you're not going to be the boss or the owner. There's going to be one owner and about 6 doctors that work for that owner. So you're not seeing the same returns that a lot of private practice dentists are now or have in the past 20 years, basically, because of that. Another thing that they're not going to tell you until you get to the end is that associate dentists, so basically just not an owner, you only get to take home about 30% of what you produce for the office. That one hurts because you work hard for what you do, and it just sucks to see somebody benefit more greatly than you are for what you've done. The trade-off being is they give you patients and you give them profit. That's the trade-off. Is it a fair trade-off? No. So that's why you usually only see associates for like 3 to 6 years until they're like, okay, I got to do something different. I understand how all this works now. I've got my handle on the clinical dentistry and I'm ready to kind of take on the business aspect. But some people that the business aspect does not appeal to them at all. You might see them stay in an associate position longer, especially females who want to raise kids, because the burden does fall more on us a lot of the time, and we have to be more flexible and leave work and things like that. So it gets a little tricky. The ugly, it's basically customer service inside people's mouths. So you will be helping them and they will treat you like you are hurting and abusing them pretty much all the time. So there's a dissonance there that is pretty tough. Also, women in dentistry, I think it's almost up to half now. My class was 60-40, males to female. So I was like, great, yeah, we're getting up there, half and half, like life's good. And I had a great amount of respect from my other classmates, but then you have to go and deal with society, and people don't give you that same respect. So I just wanted to talk a little bit about that today as well. Alrighty. So first of all, loans. The loans are no joke. And they don't really teach you about how much money you're taking out. So again, I grew up in Michigan. I went to in-state dental school at U of M. I ended up for the 4 years borrowing about $275,000. And I think I had varying interest rates, but they were like between 4.6 and 6.8, I think. So I had a range. And then after 2 years of working, I actually refinanced away from the government so that I could combine all of those different loan interests and keep them down in the 4 range. So although that was smart and it really helped me save money, I don't get pandemic relief because my loans are not governmental. So it's like you kind of get burned for being smart about your money. So that's annoying. So I just wanted to let you know that. And then, of course, by the time you pay it off, you're going to end up paying about double, if not more. I do know someone who lived in their parents' basement and pretty much just ate all their food and paid off his loans in 4 years. So it can be done. It just kind of depends on what lifestyle you want to have. I could not go live with my parents anymore. I was tired of being a child. I just wanted to grow up. So that was not something I can do at all. I was just ready to be an adult. So that wasn't for me. And even if you want to, get a pet, get a new car, not even something super luxury, just a new car, there's all these other things that you want to do. You want to live your life. So it's like you'll be depressed if all you do is pay off your loans, in my opinion. All right. And then dental insurances. So this is the main way that we get paid. I don't know the exact numbers on how many offices take insurance versus how many are what we call fee for service. So basically, we don't take any insurances if we're fee for service. We just charge the patient the amount. But it's hard to get patients to go away from their insurance to do that. So if I had to guess, it'd probably be like 2/3 and take insurance and 1/3 don't. Again, a lot harder. You have to be extremely skilled. You have to be really good at selling yourself, which is not something I really enjoy, but ask me again in 10 years, I might feel differently. Let's see. Yeah, will you skip to the next slide for me? So the way insurances work is you agree to charge a certain amount for a procedure. They refer patients to you, they put you on their website, they help them find you, and then they only actually give you a percent of what you both agreed that you would charge. What? So for example, in like a tooth surface filling procedure, this is like your bread and butter dentistry. Let's say you set the price at $250 and the insurance agrees that that's a good price to set it at. So the insurance company then decides, okay, we're actually only going to give you 178 of that $250. So they will pay for 80% of that 178 and the patient will pay the other 20% of the 178. But you will never see that other $70. It's illegal for you to collect over what the insurance has decided you can pay or they will pay. So again, fun. And then sorry, I have dogs. They're going to bark at least once here. In 2014, Delta did something new where they decided everyone who graduated that year was going to get paid less for no reason, other than the fact that they just wanted to start paying dentists less. So I graduated in 2016 and I didn't even learn this until I was a third-year dental student. So I was a D3. And so I was just like sitting there like, why didn't anyone tell me this before, you know? So that sucks. And it really depends where you're practicing. They average it like by your zip code and like the average cost for procedure. It makes absolutely no sense. Archie, no. So, sorry. So this is just an example of the difference between a PPO dentist and a premier dentist and the cost difference, but it really varies on location, where you're practicing, things like that. And this is a Delta thing. I don't know if Delta is completely nationwide, but I know they're, Archie! I know they're in the bigger states like California and stuff like that. Now, dentists can't unionize because we're like doctors for some reason. I don't exactly understand all the legality of that, but we actually can't take insurance companies to court. So what has to happen is then the organized dentistry. So like in Michigan, it's the Michigan Dental Association, or there's a California one. California is actually pretty great. They've taken Delta to court many times and won, which is awesome. But then there are states like Michigan and I think Wisconsin too, that are a little bit more old white man leaning, and they don't have as many problems with this. So we don't have that protection here in Michigan that they got in California, which is sad. And let's see, I think, oh, and then to top it off, they market PPO plans cheaper to patients. So what they're trying to do actually is get everybody into PPO so that no one's getting premier rates anymore. And again, we can't take them to court because we can't unionize. So just another thought to keep in mind. All right. Oh, all right, let's go to the next slide. So my favorite thing about dental insurance is if you can get over all that, my favorite thing is then they don't even want to pay for what they're supposed to. So these are real reasons that I've had treatment denied being paid for. And once it's denied, I just don't get paid. You can't charge the patient for it. You can appeal with the dental insurance, but that essentially gets you nowhere. So I've gotten fillings denied because my x-ray wasn't recent enough. You have to have an x-ray within the past 6 months usually, otherwise they'll deny it. So what does that mean? That means we're taking excess x-rays sometimes. Do I want to? No, but that's what your insurance decided that you needed for me to pay for this. If the tooth was worked on less than 2 years ago, they will not pay for anything on that tooth. So let's say you fixed like the cheek side of the tooth and then they got a cavity in between the teeth, they ain't gonna pay for it. And your patient's gonna be mad too. So oftentimes I feel like I see people almost overtreat because they don't want this to occur. So if you see a cavity on one side of the tooth and you're kind of hemming and hawing about that other side, maybe you really could wait. But the problem is if you wait and it becomes a cavity, insurance company won't pay for it. So again, they're pushing us to overtreat a little bit more, which I don't like. I don't like the way that feels. Oh, and my favorite is if you chip your front teeth, they are not going to pay for that. They typically only pay for things if there's decay. So cosmetic things like veneers, they're not paying for that. Especially implants. You have to have pretty good insurance to get implant coverage. Implants are considered elective, even though they can restore function and give you more teeth to chew with and do a lot of other great things, but dental insurances see them as elective. All right. And my favorite parts of dentistry here. So let's just go through a typical day of what being a female and a doctor is like. We huddle in the morning. Most offices huddle. You kind of like take 10, 15 minutes before the day to go over, any special things, any patients who have what issues, what they need to be addressed, if we're coordinating between a hygiene and a treatment appointment. So we kind of have a chat every morning. And sometimes you get talked over while you're talking, while they're supposed to be listening to you. And it's especially tough when you're young. I'm younger than everyone else in my office. And they've all been doing this longer than I have. So I understand where their lack of respect comes from. But how much school, how much crap, how much money have I put myself through to get here to be a doctor? I have earned this respect, and you have to fight for it. You have to keep fighting for it all the time. And I do have a little bit of juxtaposition. My husband is also a dentist. We met in dental school. So his day in and day out is just different. Like he will struggle with have a dentistry thing go wrong, or like the timing in his office is crazy. But he doesn't get emotionally challenged as much as females do, I would say. And this is not just my experience. Obviously, I have female friends who are dentists. We're all kind of in the same boat on this. So I give mad props to all the females before us because I know it only gets better with time. So like, if you see an older female dentist, give her mad props because she's been putting up with this shit for a long time. And moving on, the owner doctor will ask for your input on something about a material or about how to handle a situation, and then they'll just do the opposite. And you're like, okay, why'd you even ask me then? Why am I here? The first patient of the day says, I hate you, right? Or I hate being here, or this is terrible, or you caused my cavities, or patients will try to push their problems onto you. So you have to be like, nope, this is on you, not me. I don't own this. Because if you do, at the end of the day, you go home and you really just feel like crap. So yes, have a strong skin is basically what I'm getting at here. The fourth patient of the day smacks your assistant's butt. Obviously, we know that's wrong, obviously. But it gets a little tricky because you're sitting there and you're like, well, I know what I would do. I would dismiss him, like, duh. And yeah, duh. But what if that guy is the most prominent real estate dude in town and he's got a lot of reach? What if he sits on city council? What if, there are so many mitigating factors that you have to be aware of. So you can't always react to every situation how you want to react to that situation, especially when you don't own the place. Like I can be okay with dismissing a patient, but my boss is like, no, we need to keep them. So that's not always fun when you're not the owner. You'll hear this a lot. New patients can be really secretive about their health histories for some reason. I don't really get it, and they'll tell you that you don't need that information because you're just a dentist. Why would you need that? You're here for my teeth. Why do you need to know about my heart? So you often have to explain why those things are important, and that just eats up time and patience and energy. So that's real. A lot of patients, especially males, will drop the doctor and just use my first name. And I'm a pretty chill person. I really don't care, except for it's on purpose. They're trying to take me down a notch and make sure that I know that they feel that they are on the same level as me. It's the same reason, like you've seen a couple senators in the news lately asked to be called Senator Blank. It's the same thing. I earned that doctor. I earned that degree. If we have a relationship where, you know, we're comfortable and we're on a first name basis, great. Even if you just ask, like, hey, can I go call you by your first name? I'd be like, yeah, sure, whatever. It's just the assumption that is really bothersome and sexist. I am 30. I don't have kids, and people look at me like I'm funny. They're like, you don't have kids? Like, what's wrong with you? And it's like, I've been going to school, trying to learn to be here, to be your doctor. I haven't had time to have kids, okay? Also, mad props to the women who have kids in dental school, because y'all are like next level. Like, whoo, can't even imagine what having a baby during dental school was like. And a couple girls in my class did. So mad props to them. This actually happened to me. I had to dismiss a patient because he didn't want to talk to me about his health history. And I have an open concept office, which means the rooms aren't like closed. They're kind of just like chairs, and they're just like divider things. So he screamed throughout the office that I hated men as he left the office. Now, is that true? No, I don't hate men. Like, the world is half men. I wouldn't have very many patients if I hated men. So you get categorized as something you're not a lot, or like the next guy who thinks he knows his diagnosis before he even comes in, and you tell him that, no, that's actually not what's happening, even though that's what WebMD says that's not what's happening. He'll go and he'll leave you a negative Google review. I don't know if any of you guys have ever been on Google or have small businesses or anything like that, but contacting Google and getting anything off of Google is like next to impossible. Like, you just can't. You're just going to hit wall after wall after wall. Your best chance is to contact the person and try to remedy the situation. But when the person had decided that they didn't like your diagnosis, there's really not a whole lot of remedy to be had. So it's another way where dentistry is a little bit more the patient is always right, because our businesses are affected by Google reviews. Medical doctors have like health grades and stuff, but they're not as tied to the business aspect of it as dentists are. It's all kind of one and the same sort of thing. Oh, and then my favorite is when old men ask me to turn around. And the first time I did it, I was just like, oh, like, is there something on me? You know, and whatever. No, there wasn't anything on me. They're just creepy old men who haven't seen any young females in a while. So there's that. And this, by the way, this is all just interpersonal stuff. This is not the dentistry. This is not that you're running an hour behind, that the lab sent the wrong crown, that Susie has such a high gag reflex, it takes you triple the amount of time to do one procedure, and now you're behind. Like, there are so many other layers to this. This is just the interpersonal stuff. But again, I thought that no one really talked about this before, so I just wanted to bring this up. You spend all of your good energy during the day at work. On the weekends, yeah, you have more, you're doing your own thing kind of, but you work usually 4 to 5 days a week. So this is your life. This is a lot of your awake time. So I feel like that's why liking where you work is really important, and making sure that you're investing in something you want to do. Really think about what you want your work life to feel like, and how much you're willing to put up with to get there. Like I said, I grew up playing ice hockey. I can talk shit with the best of them. But the problem with dentistry is you can't talk back. You just have to sit there and take it the whole time. So I can dish it, but just taking it all the time is a lot for me. It's just kind of a lot. So develop a strong skin. A lot of dentists I know end up taking antidepressants or anti-anxiety medication their first couple years in practice. So try to just develop a strong support system, really stay in contact with those people in school. There's a little bit of this like underlying competition layer with your classmates. I really encourage you to just nip that in the bud right away, because everyone is struggling their first couple years out of dental school, everyone. And it's going to be about different things. It's going to be about a crappy boss or a crappy office or a tough patient pool. You know, it's going to be a struggle. So just try to, you know, be as friendly as you possibly can after you're done competing for grades or whatever you think is important. I already talked a little bit about this. You know, it's your life isn't really going to change for at least 10 years after dental school. I mean, like I said, you're going to be a little more comfortable, but it's not what you think it's going to be. It's not what they've said it's going to be. It's not like that until you either own something or you've paid off your loans. So keep that in mind. Dentistry also breaks you physically. I met with an occupational therapist before I started working. I use a saddle chair as a short female. It's really important to keep your hips up and open. So I knew that this profession was going to be tough on my body. And then when the person isn't even thankful or worse, they are combative. It's just like, why am I doing this? Why am I breaking myself and exposing myself to disease for y'all ungrateful people? So again, keep that in mind. All right. Now that I've said all this, let's end the negative portion of this talk and go to the happy portion of this talk. So I don't know if any of you guys are Grey's Anatomy fans out there, but they like to joke that the dermatology is like the nice area in the hospital or like the calm and relaxing area. And that's kind of what facial aesthetics is for me in terms of dentistry. So facial aesthetics isn't a recognized specialty. It's just kind of more of a, I don't know what the right words are for it. It's not recognized, but that doesn't mean there isn't a ton of training and certification to be done out there. I personally belong to the AAFE, which is the American Academy of Facial Aesthetics. It's a dental run facial aesthetics company, if you will, but a lot of doctors and other like nurse practitioners and stuff, they take courses through here too. So what is facial aesthetics? Well, it's kind of just taking a look at all the features of the face. I mean, as dentists, we do like the nose and down quite a bit. So it was really just like applying these same principles to like what goes above your nose. Basically what I do are Botox, fillers, skincare, that kind of thing, in addition to the dentistry that I already do. So I do crowns, I do fillings, I do all that stuff. But this is a little bit of my happy time. This is what I really love doing. And part of it is because patients love to see me. Like they look forward to these appointments. They text me, they call me, like they're just pumped to be there. And it makes them really nice to work on and to work with. Not to say that they aren't high maintenance still, they are, but it just seems to be a better give and take than the normal like dental appointment. So when we want to talk about beauty, and this is in photography too, is the rule of thirds. So if you break the face up into a couple different parts, you got the hairline to the top of to the bottom of the eyebrows, bottom of the eyebrows to the bottom of the nose, and then bottom of the nose to the bottom of the chin. You can see the lady on the left is a bit more symmetrical than the girl on the right. Are they both beautiful? Absolutely. But like, look at this girl on the right. Because if you saw her on the street, you'd be like, oh, she's pretty. But you can see her right eyebrow, and remember, patient's right is our left. So her right eyebrow is higher. Her left eye has a little bit more open, and it's actually a little bit lower on her face even. You can see her right cheek sits higher, and she has more of a cant to her smile up to the right as well. Your midline, so the center, the line between your two front teeth is supposed to line up directly with your nose. If you look really, really closely, she's actually canted a little bit to her right. She's not actually perfectly symmetrical. But that's what I do. I nitpick faces all the time. So if this person came to me, we probably focus most on her uneven eyebrows. I think that's where her aesthetics is being thrown off. But the rest of it for her is really, really subtle. So I wouldn't change a lot about her face. I'm not interested in making Kardashians. I'm not interested in making doughy cat people. I just really want to make you look like you forever. I want to make you look like you're in your 20s forever. I don't want you to end up on some botched show or anything like that. That's really not my goal here. My goal isn't to create YouTube stars. My goal is just to make you look like the best version of you. Alrighty, so let's keep going here. So what do patients come to me saying? Or do they just mention it, you know, while they're at their dental appointment? You kind of become their therapist or their friend sometimes, because once you get their teeth looking really nice, they'll start to point out things about their face that they don't like. And that's where you're like, well, I can help you with that too. So easily people will complain about fine lines, wrinkles, like I'm starting to look like my mom, or I have this big old line in my forehead that didn't used to be there. So that's kind of the obvious stuff. But there's also a huge part of facial and neck pain that comes with these clenching muscles. So these muscles right here in the corners of your jaw. If you look at this picture of Olivia Culpo here, she has giant masseters in that left photo. And you also have your temporalis muscles up here. All these two muscles do is close your jaw, close your jaw. So unless you chew gum about 24 hours a day, you shouldn't look like Olivia Culpo here on the left. If you do, you're probably clenching your teeth. You're probably doing it when you're studying and when you're sleeping. Some people do it when they drive. Some people do it when they vacuum. I kind of do it 24/7. But it's not good for your teeth to be clenching all the time. You want to think like swallow and just relax. There should be a small gap, like maybe a millimeter or two between your teeth when you're just sitting there. So if your teeth are touching all the time, you're actually clenching your teeth. And then if you work at a computer, I've got some lab people. I work in a university town, so I have a fair amount of lab technician patients, and they're hunched over a microscope looking at slides all day. So they get a lot of this pain, especially now everybody working from home and at Zoom is all doing this, a lot of this and looking at your phone like this. So your trapezius muscles here, I can actually use product 2 to relax those, and it will get rid of a lot of pain in the face. It's just referred from your shoulders. It's referred from what you're doing all day, but it ends up in your face. So sometimes people come to me with tooth pain, and I figure out it's actually coming from their trap on the left side. So interesting to kind of treat patients holistically instead of just looking at their mouth. Again, yes, chipmunk or cherub, that's her on the left here. But you can see after consistent Botox, those muscles are a lot smaller. So her teeth are a lot healthier now because she's not putting so much stress on them all the time because she can't. She doesn't have that muscle buildup anymore, which is great. And then yes, you've got your people who love filters and stuff like that, and they don't like their thin lips and they want to look like Kylie Jenner. And of course, I will, I'm obviously going to help you, but again, I will turn you away if I think you're at a point where you should stop. I don't approve of body dysmorphia. I think sometimes a lot of the times the Kardashians have kind of gone over the hill. So if that's the kind of treatment you're looking for, you got to go somewhere else. That's not really what I'm into, but I do want to help you look like you. Especially as we age, you can see these pictures of the corners of the mouth here. So gravity doesn't do us any favors. As we age, all of our fat drifts down to the bottom kind of our face here. And what that does is it'll actually create these little creases in the corners of your mouth. And those will get wet and then dry and then wet and then dry. And what that is it's actually a fungal infection in these photos. It just looks like dry skin or psoriasis or eczema or something, but it's actually a fungal infection. So using dermal filler, you can pick these areas back out, kind of replump them back out, or put filler in the cheeks so that you're redraping the skin, kind of pulling it up so that those creases don't occur anymore. And then they don't have to use steroid creams on their faces to get rid of these fungal infections. And steroid creams over time will weaken your skin and give you wrinkles. So not the cutest. And then black triangles between people's teeth. If you've had gum disease, you definitely have these. If you've been an aggressive brusher or an aggressive toothpick user, you may have a little bit of this too. Basically just as we age, so as people get older. Now, there's only so much I could do with your teeth. Like if you look at the teeth in this photo, I really wouldn't want to replace or put veneers on those teeth because they're going to make them look really bulbous, like almost like chiclets, or they're going to be really obviously fake if I close that space because the measurements are just way too big for that spot. But what I can do is take a little bit of filler and put it right in that little triangle right there so that you can't actually see that there's a little gap between the teeth. So it kind of camouflages it, if you will. And then you don't have to cut into the teeth. You don't have to spend $3,000. So it's just a lot more minimally invasive to get to the same result of getting rid of those little triangles in there. And like I said, uneven eyebrows. A lot of people have those. All right. So what do? I mentioned Botox. You probably heard of Botox before. Probably don't really know what it does. Botox is a toxic protein. It is injected into your muscle tissue. And over time, it just stops those muscles from working. So it takes about 2 to 10 days to kick in. What's happening is your muscle fibers, they're taking in these little proteins via endocytosis. And then what they do is they cleave all the proteins inside that cell and that axon there, so that nothing else can get out, so that you can't signal acetylcholine to be released, so the muscle can't contract. Now, after 3 to 6 months, those endings will kind of, die off and new ones form to kind of still get to that acetylcholine release. But you're basically a little frozen in those spots. But as you can see, I've had Botox and I'm still expressing quite a bit with you guys here. You can put enough Botox in so that person can't move their thighs at all. That is possible, for sure. But if you put a little less in, they can still be expressive without furthering those lines or without looking really old. So it's a nice balance that I like to try to hit, is that for in between. Now there's some ladies, especially the older ladies in their 60s, who are like, no, freeze me. I want to look like I came out of the womb. And I'm like, all right, like whatever, this is your life. I'll do what you want with the Botox. But for younger patients, I typically like to let you be a little more expressive because you're a little more animated as a person at that point. Alrighty. And what would I use to diagnose this? Let's skip forward. Basically just your eyes. There's not really a whole lot of like diagnostic testing for this. At most, I'll ask people to bring in a picture of themselves from their 20s or like 10 years ago even. And what I'm really looking for is the volume difference. So if you see this lady on the split screen here, you can see her face like younger and then aged. So if I could see this picture of her when she's younger, I kind of know where she should have volume. I can put volume where I think it needs to go based on beauty principles. But again, I'm trying to make you look like you, not like a Kardashian. So I really like to see older pictures of patients to kind of know what I'm shooting for. If you've never had puffy cheeks, I don't want to give you puffy cheeks because that's not you, And then with doing Botox, you just ask them to activate. So on the left photo here, you can see what's called a dynamic wrinkle. So wrinkles that occur when you're activating your muscles. And then you can see it really, really slightly on the right there, there's a static wrinkle. So that means a wrinkle that is present when you aren't doing anything, aren't expressing, aren't doing anything. If you're starting to see static wrinkles, so wrinkles when you're just resting bitch face, that's when it's time to get started with Botox. So again, it's caused by muscles. Muscles cause wrinkles. Your skin laxity does participate, but again, you treat the muscle, those wrinkles are going to go away about 85% or so. What muscles do I inject? Well, there's a lot of muscles in your face, a lot of really, really tiny little muscles. But I would say the most common ones I do are your frontalis, so the one that raises your eyebrows and will give you those forehead kind of wrinkles. The glabella area, this area between your eyebrows and your corrugators. I'm trying to, look at mine while I do this. But yeah, if you squint, kind of furrow your eyebrows, those are your corrugators, and your procerus is in the middle right there. So those are really big ones to hit. And a lot of times when people get migraines, I will treat that area as well as the clenching muscles, because it's usually because you're squinting all day at a computer or something like that. So it's nice to treat that, and you'll have a lot less headaches, myself included. I don't even sit at a computer very often. And if I treat that, I get less headaches. So it's pretty great. You don't really do a lot of Botox in the cheeks. That's not really where that needs to go, because you don't have a ton of muscles that are causing wrinkles in your cheeks. You often need volume. You often need filler in your cheeks to kind of plump things back out again. If you have smoker's lines or water bottle lines, those like very fine lines that kind of go around the lips, you've probably seen them on your mom maybe. You can prevent and lighten those up a little bit if you actually do a little bit of Botox in the orbicularis oris, the muscle that kind of goes around your mouth. So what that will do is we'll relax it a little bit. Now you're not gonna drool on yourself unless you have too much of it somewhere, but it is a little weird to drink out of a straw at first. You're like, oh, I can't do that. Okay. But it actually flips your lips a little bit too. So you can get a little bit more of vermilion show, which is like the pink part of your lip. You can get a little bit more of that to show. So it does look nice, and it gets kind of rid of the lines around there. But some people don't like it because they don't like that they can't create that really strong suction with a straw. So if you're a big iced coffee person, you're probably not going to like the lip flip. All right, let's keep going on here. Oh, yay, cases. So this is a case I had. She's 32-year-old, and she comes to see me for dental stuff, but we put up stuff around the office. So she was like, hey, do you do Botox? And that is my favorite way to treat a patient for Botox, is when they ask me. I don't say anything to anyone. I'm not like, oh, those lines in your forehead though, or we should get going on this. I honestly don't bring it up unless they ask me first. And they're often just thankful because they want to learn from someone who they trust. They don't want to feel like they're being sold something. So that's really important to me. And I don't ever want to tell anybody that they look ugly or that they look old. I might think it in my head, but I'm not saying it. So for this lady, she could see, you can actually see in her forehead in a couple of the more resting photos, you can see where her makeup is settling into those lines there, or around her eyes a little bit too. So that was her biggest thing. She didn't like the way that she was starting to look. So what we did was we did a little Botox in all of those areas, in the frontalis, right in the procerus and the corrugators, and then the orbicularis oculi, the one that goes around your eye. That's the one that's going to give you the crow's feet. So if we flip forward here, we'll see her after. Oh, and by the way, she's not wearing makeup in these photos, and this is also at 7 a.m. There's one day a week I start at 7 a.m. So her natural expressions are just not there because she's obviously not very awake yet. But you can see, I still left her with a little bit of activation. She still can get to those dynamic wrinkles a little bit, but that's okay because again, she's young. I don't want her to look frozen. Like, what's that one lady in that movie? Oh, I'm bad with names. Anyways, she is like, I can't talk, or I'm smiling on the inside, but my Botox is fresh or something like that. I don't want younger people looking like that because it just kind of gives a bad name to Botox. And if you're over treating that much, again, we're getting closer to body dysmorphia if you're that young. So if you go to the next slide, I think I have the next door to each other photos. Yeah. So you can really see kind of the improvement she's gotten in these areas. Now, Botox will last anywhere from 3 to 6 months. It depends on how often you're trying to stimulate these things. So for someone who clenches a lot, you're going to need to see me every 3 months. Like, you're going to tell the morning that thing wears off. But the aesthetic stuff for the face, it's more of just like you start noticing like your makeup is settling again, or you walk by mirrors and you're like, oh boy, my forehead is looking very old today. And then you're like, oh shoot, it's been about 3 or 4 months. It's time to go back. The other thing I can do, let's go forward here. So that was a younger patient. If you're an older patient, say 45 plus, and you haven't ever done anything for your skin, there's kind of a ceiling I can hit with how much improvement we can get. So as you can see, is it improved? Yeah, absolutely. Does she look about 10 years younger? Yeah, for sure. But I can't fully get rid of those lines because she's been making them for 40 years. So again, prevention is the best medicine. It's always better to start early than it is to kind of go in later. Now you can do chemical peels and things like that, a little bit more invasive to try to get rid of those kind of pervasive lines. I don't really do that kind of thing. I feel like that's more of a dermatologist needed supervision on that. So if you're wanting to talk about acne or peels or any of those kinds of things, I'm just going to send you to the derm because I'm really just here doing the kind of the beauty stuff. I don't claim their profession. I'm not trying to step on any toes. I don't treat skin malignancies. I just kind of am interested in this sort of stuff as it relates to dentistry and aesthetics. All right, I think we have fillers coming up next. Yeah, so you can also inject dermal filler. Like I said, this is not freezing anything. What we're doing is we're actually just kind of creating volume again. What filler is it's a hydrophilic gel. So that means it loves water. It wants to drink up all the water in your skin. So if you have a stubborn wrinkle and you've lost some fat, we can put some filler back in there to kind of plump that wrinkle back out. And that's where I'm talking about on the cheek area. So if we treat you for crow's eyes or crow's feet and you still have those wrinkles like that older lady in the last one, she actually needs some cheek filler to kind of plump that skin back out so that you don't see those little divots in there. We can use this in a lot of places in the face. I absolutely cannot put it here between your eyebrows. And that's where everyone wants it because of their 11s, but I can't put it there. The reason being is there are a lot of important vessels right here. And if you put it there, you can actually cause someone to go blind. So be very, very careful. Or if you, something else that's really popular are the liquid nose jobs. Basically what that means is they're putting filler in your nose to either hide a little bump or hide a cant or something like that. Never do that at a med spa, ever. Like, go see someone who's really, really good at this, because the chances of blindness when you get filler in this area is high. So I don't treat eyes. I don't do under eyes. I'm just not prepared to deal with an adverse event in that situation. And you're like, okay, what's an adverse event? How could this go wrong? If you inject this into a blood vessel, you occlude that blood vessel. So what will happen is blood can't get to those tissues, and that's when you get tissue necrosis or tissue death. So if you've ever seen some of those really scary like post lip filler things where their lips are like giant and black, that's what happened. There was an occlusion. Now we do have a product that can go in and dissolve, but you have to be, you have to know what you're looking for. So if a patient is starting to turn like mottly black or starting to get like white and you send them away, that's where things are going to go really, really bad for you. But if you see it happening in real time, you can correct it. There's a product called hyaluronidase, which actually goes in and it will destroy and melt kind of all that hyaluronic acid. But you got to get to it fast, because tissue without blood is going to die pretty quick. The results are immediate. You'll see in some of the photos here, these are like immediate before and afters. And it lasts about a year. If you're a person who does a lot of CrossFit, you're looking at like 6 months probably, because you have a high metabolism. Your body is turning over all these things. These are technically foreign things. They're really nice on your body, but they're foreign. So eventually your body's going to try to get rid of these. So if you're, like I said, if you work out a lot, these are wearing off faster. This is a great example. So this patient's 34. And she just felt like she always had resting bitch face, or she always looked sad or mad, especially after wearing masks all the time. I feel like a lot of it just kind of pulls downward. So she was just interested in kind of just like youthening up, but she didn't know. She thought that she needed filler in her nasolabial folds and kind of that like nutcracker sort of area near the lip that goes to the chin. But if I did that on her, it was going to look really heavy in her lower face. She was almost going to look kind of blowfishy if I did it that way. So in her case, what I decided to do was to give her more cheek volume. If you think of your face, the bones of your face like a chair, and your skin is like a curtain draped over that chair. If you make the chair bigger with the same curtain, the curtain is going to hang differently. The skin is going to hang differently. So let's click forward here. You can see her afters. Look how her skin is hanging differently. Does she still need a little bit in her nasolabial folds? Yes. Does she need as much in that nutcracker area though? No. And I'm really glad I didn't put any there, because it would have made her look really heavy on the bottom of the face. And she even kind of looks like she's smiling a little bit in these photos, but she's not. She just got rid of that like wompy jaw kind of sort of situation. So I think if we have a video here next, there's no volume. It's kind of a sped up video of me doing the procedure. If you're wondering what she's holding there, that's a little distractor. It's like basically a little vibrator. Your brain can only process so many stimuli at once. So if you distract, it actually can't tell as much pain. Now I do numb you. I put a numbing cream on your cheeks and everything like that, but I'm going below the skin. So it helps, but it doesn't make it totally painless. So the little distractor thing just kind of helps some people. I'm sorry, my assistant took this and she's a boomer and she does not do recording. So I'm sorry for this video quality in general. You can see I've drawn on Vanessa's face here. Once we go to the other side, you might be able to see a little bit more. But what I'm doing is I'm actually going in with the needle. I'm hitting bone. And you'll see me pull back with my thumb a little bit. What I'm doing right there is it's called aspirating. What I'm making sure I'm doing is I'm not in a blood vessel. If I pull that back and I get blood in my syringe, I know I'm in a blood vessel and I need to move. I should not inject there. Again, sorry for this video. But, so yeah, here we go. You can see a little bit more of me. See, pull back. I didn't get any blood, so then I go ahead and inject. Now I'm only injecting small amounts of this at once. It's not like I'm smushing all of this in her face. It's not a filling. We're not smacking it in there. It's very, very light. And the reason being is because you can also occlude a vessel by compressing it. So if I put too much filler in one spot, same problem. I'm going to occlude that vessel because it just got weighed down by a bunch of filler I put in there. You can see the patient is going to bleed. It's best if they haven't drank or taken any ibuprofen in the last couple days. You'll get a lot less bleeding, but trying not to make someone bruise or not hit a blood vessel is like a needle in a haystack in the face. There are so many blood vessels in the face. I should have put up a picture of that too, but there are just so many. So don't promise you can't bruise someone because you will likely bruise someone. I won't treat anyone within 2 weeks of a big event. Like if you're getting married, no, you should have came to see me a month or two before because you're going to need some time to heal. Now filler is manipulatable. So you'll see me push on her face quite a bit here. What I'm doing is I can actually feel where that filler is in her face. So I'm pushing it to make sure it's going in the direction I want. You see, I make her sit up. I go on both sides of her. Right now I'm going behind her actually to make sure that it looks symmetrical from every single angle. Because it's not like you only look at people straight on. You know, people are going to be standing on the side of you in pictures, you know, at 45-degree angles. So you really want to make sure it looks good from every single angle, not just the front angle. And of course, she's got to show me pictures of her dog when we're done. All right, let's move on. Ah, yes, her before and after. So you can see she looks a lot more jowly, a lot sadder in the earlier photos versus if we just give her a little bit of cheek lift. And you saw I only did one syringe here, nothing crazy. If you're 65, probably going to use 2 to 3 syringes just because you've lost a lot more volume over time. But for younger patients, typically 1 syringe is fine. And some people have great cheek volumes with like little chins. So again, we're going to put the filler where you need it. I'm always looking at that rule of thirds, trying to balance the 3 parts of your face is really what I'm trying to do. But filler doesn't really go up in the forehead. It's mostly just Botox up there. All right, we got another case here. This patient was transitioning. So if you flip forward here, this patient was a biological male transitioning to female, longtime patient of mine. So I kind of got to learn with her as she was going through this transition, which was awesome. I really thanked her for being so open with me so that I could be a better provider. But her biggest thing was she wanted lips. She's like, I want to wear lipstick. I don't have lips. And as you can also see her jaw here, her lower jaw is bigger than her upper jaw, which kind of gives her that piranha sort of angry look, if you will. That's called a class 3 bite. Class 2 is when you're like, you have absolutely no chin. You kind of look more like a turtle, like Mitch McConnell. That's more of a class 2. And class 1s are like just kind of normal, straight across. So with this lip filler here, I was able to give her a little bit more of an upper lip, but I was also able to disguise that class 3 a bit too. Now, she actually really needs jaw surgery in order to correct this discrepancy, but getting jaw surgery at her age is a lot. That's one of the hardest things to heal from, is where they have to break your jaw. So that really wasn't in her treatment plan. She really didn't want to go through all of that. And she was really, really happy with what we could do with just a little bit of filler. All right, I think I've got one more case and then we're gonna wrap it up. Yeah, so this is a good case of something that was just really subtle. So her husband didn't notice, her kids didn't notice that she had anything done. So if you don't want to tell people you've had stuff done, find someone who will do it minimally with you. For this, obviously you can see kind of the little pokes that we did in her nasolabial folds, which is from your nose to the corner of your lip. And then I actually evened out a little bit of her lips here too. and we put a little bit in her chin as well. So I was just balancing those thirds and balancing left and right, trying to make her a little bit more symmetrical, which is how we got to this result. And she was super happy with this. So, and I think that's about it. Yeah. So my advice is enjoy college as much as possible, because adult real life is pretty monotonous and you don't have all those people around you to commiserate with and have fun and just randomly call up and go somewhere on the weekends. If I had to say, if I miss anything, I really miss the camaraderie of college. So enjoy as much as you can, but also take time to think about if dentistry is really for you. I hope you learned something today that you didn't know before. I hope it makes you think a little bit more about the decision, the $500,000 decision that you're going to make. But you can be happy in dentistry, for sure. And I feel like I've found an alternative avenue to do that. So yeah, just be sure. It's just a lot of investing. So be sure. And then I think the number one question I get with pre-dental shadowers is, what about my hand skills? What can I do for my hand skills? Nothing. Like, just go to dental school. You can teach a monkey the hand skills. Like, you're going to get there, but it takes having those actual tools in your hand and doing it like upside down in a fake head. Like, you can't practice that. There is no practicing that. If you really, really want to be extra, you could practice your indirect vision. So like, hold a mirror in front of a piece of paper and write your name by only looking in the mirror, because that's what you're going to be doing in dentistry. You're going to be working through a mirror. You're going to be working backwards most of the time. So I feel like that was the hardest thing to get used to, was working through a mirror. So I think you can actually Google indirect vision exercises if you really wanted to work on something. I would say that. I know there's some dumb question on AdSAS. It's like, what have you been doing for manual dexterity? And everyone writes, I play violin, or I do jewelry. I don't even know why they have that question on there. It's just dumb. But you got to play the game. So play the game. And my biggest thing is, don't let your career become your entire identity. Unless you're going to be a dental influencer, and then you kind of have to. But you're gonna end up really unhappy if you leave your happiness in the hands of others. So that's my biggest thing. Make sure you've got hobbies and other things to look forward to. Otherwise, dentistry will consume you.
Well, Dr. Keil, thank you so much for that very intriguing presentation. And thank you so much for talking about the cons and the pros and cons of dentistry, as well as your experience with the facial side and the aesthetic side of dentistry. Mm-hmm. So now I'm going to be handing the floor over to Krupa, who's just going to be answering a few questions.
Yes, I just wanted to thank you too, Dr. Keil. That was a very insightful presentation, and a lot of our viewers really enjoyed how honest you were and learning about things that they haven't, heard about before. So I saw a lot of questions about people asking what your thoughts are on corporate dentistry.
You really want to know? Depends. It depends on the corporate dentistry. So I would say most of the time, corporate dentistry is not where you want to be. The reason being is because the people in charge are business executives. So they analyze spreadsheets, they look at productivity, they look at money. They're not looking at people. So you can still be giving good care in those environments, but the top is going to be pressuring you to go faster, to do more, and to, a little bit, in my opinion, over treatment plan. So that's why you see a lot of high turnover of dentists in corporate offices, because you're just an employee and they treat you that way. And I don't like people telling me how to treatment plan, because at the end of the day, my license and my name are on all these procedures, and I have to sleep at night. I have to know that I did right by people. There's a lot of people out there that don't have as loud of consciences as I do. So if dollar signs are all you see and all you care about, you're probably going to love corporate dentistry. So I won't say it's not for everyone, because it is for some people. And that's not to say that there's not some good smaller ones out there. There definitely are. But if I had to say it like this, Aspen Dental is the McDonald's of dentistry. Sorry. Not that the dentists are McDonald's quality. They're not. But the way it's run is McDonald's. So that's my pitch.
Thank you. And I also I saw some questions about what certification did you need for the Botox and filler procedures, and how long did it take?
Yeah, so the AAFE has like levels of classes. Their intro, like level, I think there's level 1, 2, 3, and then master. But they also have like separate classes, like just about PDO threads or lifting threads or master lips, things like that. The courses themselves, I want to say cost between like 2,000 to 4,000 a piece. The way the AFE does it is it's about 20 hours of online coursework that you're doing, and then you go in one day for live injecting. So you take a patient and they basically kind of hold your hand, make sure you're doing it correctly. And then once you've shown that you're competent there, then you are certified and you can provide those services. But you also need to get malpractice insurance for that. Which is a little tricky with dentistry in some states. Like in Michigan, I was able to do it, but I know in some other states you almost can't. So definitely check your state requirements because it really does change for every state for sure.
And I'll just go with one last question since we've gotten to 1 hour. If you had the option to take a gap year after undergrad, what would you have done?
Slept. No. I don't know. That's a hard question to answer. What would I have done? I can tell you what my husband did. He took 3 years between undergrad and dental school. He couldn't decide if he wanted to be an orthopedic surgeon or a dentist. So he went and he actually worked as a farm tech in a hospital. And then he learned he did not want to be an orthopedic surgeon. He wanted to do dentistry. So I would say, kind of work somewhere adjacent to what you think you want to do and get a little bit more of that real life experience, kind of see what's behind the curtain a little bit, but mostly just relax, like have fun, don't stress, sleep, rest your brain. Yeah, do you for a year because you worked hard.
That's very good advice. Thank you. And I think, Isa, if you go to the next slide, we have Dr. Keil's socials. Yep.
Oh yeah, I'm very open. Obviously, after this presentation, you realize I'm just a person. So feel free to DM me. I can't say I'll respond immediately or maybe even within 24 hours, but I will get back to you within a couple days or so. But any kinds of questions, I graduated in 2016 and started dental school in 2012. So to be quite honest, I think that the application process is slightly different. Like I know you guys have more hours. I only had to have 80 hours. I think you guys have to have 100 now. So
yeah, usually it's 100.
Yeah, so I may not be the best person to ask about applying because I'm a little bit gone, but more so in dental school or in practice, I'm here for you guys. I wished I had a person that I could just unashamedly ask questions to, and I didn't have that person. So I want to be that person for you guys if you need one.
Thank you so much.
Yeah, thanks for having me.
Thank you for sharing your experience with us as well. It was a very informative session. And thank you for everyone for joining today's session. Krupa is going to be posting the attendance quiz in the GroupMe, in the YouTube chat, and in our link tree. So please make sure to check that out. We also have a session tomorrow, so please make sure to tune in if you can. And I hope everyone has a wonderful day and a great weekend. Thank you.